Chair. I thank senators for your contributions to this debate in the committee. And I wanted to make a few brief remarks, although not extended ones, because I did address many of the issues that have been canvassed here this morning in my contribution yesterday. Based on the contributions that senators have made this morning, I understand that the bill will shortly pass this chamber, and I want to emphasise how pleased I am that that is the case, and I think I share that with all senators here. This bill will allow the 400,000 nurses across the country to be engaged more widely, to work more fully within their scope of practice, and that is a very good thing for patients all across the country. I note the comments about podiatry, and I emphasise, as I did yesterday, that the Podiatry Board is currently working with the National Medicines and Poisons Advisory Group on updating the podiatry endorsement for scheduled medicines. The Podiatry Board will return to that advisory group later this year as their work progresses, including to facilitate broader consideration of endorsement for scheduled medicine arrangements for the wider podiatry profession. The government is, of course, deeply committed to supporting access to healthcare and increasing access to healthcare. I note Senator Pocock's remarks earlier in relation to the ACT. We are delivering our commitment in the ACT to strengthen Medicare and bulk billing here, and just recently I saw Minister Gallagher and Minister Butler opening the two fully bulk billed additional clinics in the ACT, with another one to come. Strengthening access to public health is a core commitment for the government, to Medicare, to the investments in public hospitals, to ensuring that bulk billing expands and restoring the integrity of that bulk billing offering in the context of 10 years of cuts to services. This is core business for our government, and we intend to continue. But I do thank the Senate for your consideration of this bill, and without wishing to get ahead of the Senate processes, I look forward to the bill passing this chamber shortly.
There goes Senator Jenny McAllister, wrapping up the debate like it's all sorted. A nice pat on the back for the chamber as this bill sails through. She's thrilled that 400,000 nurses will soon work more fully within their scope of practice. Sounds good on paper. More hands helping patients, especially out in the bush where doctors are thin on the ground. But let's cut through the spin. This is the government finally acting on a scope of practice review that's been talked about for ages. McAllister throws in a quick note on podiatry. The board's still working on updating endorsements for scheduled medicines. Fair enough, but it highlights how these changes don't happen overnight and need proper safeguards. Then comes the Victory Lap, bulk billed clinics in the ACT, strengthening Medicare after 10 years of cuts. Classic Labour line. Taxpayers have poured billions into health, yet waiting lists linger, bulk billing rates have their ups and downs, and access issues persist in many areas. Opening a couple of clinics is welcome, but it doesn't magically fix the broader workforce shortages or the pressure on the system. The real test, whether this actually gets more patients seen faster without creating new headaches around training, oversight, or safety. Nurses are heroes on the front line. Expanding what they can do makes sense if it's done right. But governments love announcing big reforms while the practical rollout lags and costs keep climbing. We'll watch closely. More scope for nurses should mean real relief for patients, not just another press release.